Hi, so I've given this a lot of consideration and I'm still trying to figure out how to go about addressing this topic, rebuilding your life after cancer. On this topic, I'll be speaking to you as a survivor of cancer myself rather than a psychotherapist today. Yes, I had survived 3 cancers, been hospitalized over 4 years and suffered numerous chronic illness thereafter, so stay tuned. If I can make it through this 3 cancer, I'll do everything in my power to help others embrace life, no matter how many years I have left. That is the promise that I had made to the universe and I had made to myself when I was diagnosed with my 3rd cancer, which is a Non-Hodgkin lymphoma. My first and second cancer was diagnosed as an acute leukemia but different mutations. My life was always on the verge of going to die real soon, going to die anytime, every single day. So during that period of uncertainty and fears, one thing that kept me going was that promise that I've made to myself. If I make it through the other side, I will do whatever it takes to be a helping hand to others and embrace life. Well, apparently I made it. So from the year 2019, I've decided to dedicate my entire life to helping others and slowly transitioning my career path into a mental health practitioner today. So, if there is a piece of advice that I can offer today as a 3 times cancer survivor, it will be to embrace your life. Yes, you may be suffering from pain, you may be suffering from sorrows, griefs, or even many other things that cannot be imagined. But you still have the opportunity to live a meaningful life. No matter if it's a short life, if it's a long life, you still have the chance to live your best life. You can alter your life or make amends to what you have done or even ask for forgiveness for which you have never had the courage before. And that made me want to help others to see what I see today. And so that's what I help other people with. This is gonna be a long video, but I promise you, after this, you would find life after cancer would be way much easier, more meaningful, and help you cope with it better. If you're watching this video as a cancer patient now, remember this: being diagnosed with a cancer is not a death sentence. Being diagnosed with a cancer is not something what we want or something we have done wrong before. Sometimes it could be just our luck that we have that cancer. And also, yes, I do agree, some stages of cancer have their own survival rates, but it has been improved so much since the past few years. And also, what's the point of living a long life if you're never happy or always being miserable? We often spend a lot of energy focusing on the cancer treatment, during the cancer journey, the cancer process, but we tend to forget about the survivorship of the life after cancer. Cancer is a long-term condition and many of its side effects are permanent. Because of this, you need to learn how to accept the changes that cancer had made you and learn how to live with them. Although we may not be able to control the events themselves, we can control the responses, the behaviors of these events, regardless of how terrible they might be. This video is designed to empower you to choose responses and facilitate and benefit you. In the case of cancer, pain is not just physical, it is also emotional and psychological. Medications may alleviate physical pain, but what about emotional and psychological suffering? I'm very sure, even up till now, that suppressing my feelings back then when I very first had my first cancer and pretending that everything is okay has led to my second and my third cancers. Though there is no scientific proven or data stating that these things occur because of that, but after having too many illnesses, you tend to know, As difficult as it may be, being honest with yourself should be the very first step towards working to your emotional pain, regardless during, before, or even after your cancer. After finishing medical treatment, it's normal to feel a sense of relief and hope that things will always return to normal. But let's say that this isn't the case. Now what? Post-treatment distress is one of the highest reasons why an individual became depressed, stressed, suicidal, acting weird, not during the cancer period, but after the cancer period. And so, these are the three areas we need to look into: emotional factors, physical factors, and social factors. For emotional factors, each individual experience with cancer is unique, as their reactions, their responses, emotions, and concerns about it. How you understand and deal with cancer may be shaped by the value you were taught while growing up. Some individuals may believe that they have to be strong, they must be strong to protect their loved ones. Others rely on other support of loved ones or even other cancer survivors, as well as their religious belief to help them manage. Some may seek help from mental health provider and anyone outside the family, while others might be uncomfortable with this kind of approach. It is important to make decisions based on what is best for you and not to compare yourself with others. The common emotion experienced by cancer survivors are concerns of the recurring or the FCR, other emotional factors like feeling stressed, feeling alone, having anxiety, having depression, anger, concentration problem, memory problem, and coping with physical changes. So emotional factors, when we talk about recurring, worrying about cancer recurring is very common during your first year after your treatments, and especially when you're having a follow-up appointments, witnessing other people with cancer, similar symptoms were present, dates that reminds you of the very first day when you were diagnosed with cancer. If you're having trouble worrying about cancer recurring, please get the facts clear. For example, like I was mentioning just now, when you are going for a follow-up appointment, you're actually doing a checkup, follow-up, and not getting a report stating that you have cancer. And be clear about it. Another great way to cope with this worrying of recurring is that you should address negative emotions like fear, anger, or even grief. Many people find that they are less worried when they can express themselves honestly and work through their feelings. And if this worrying keep happening, the best way to deal with it is to keep yourself busy at all times. Emotional factors when it's stress. After receiving your diagnosis, there's a good chance that you put off dealing with some things like your family, job, finance. Now that your treatments are complete, you may feel overwhelmed and exhausted just as this problem resurfaces. Many people have overcome cancer also wonder where the stress contributes. Keep in mind that cancer still has their precise origin undiscovered. There is no conclusive relationship between stress and cancer. Many survivors found that doing some light exercises reduces stress, but you should check on your doctor first. Talking about your own experience also help you reduce stress, and a lot of research and studies had shown that drawings and dancings are a great way to reduce stress as well. Emotional factors like feeling alone. After treatment, you may miss being with the people who helped you. Now that you don't need medical help anymore, you may feel like your safety net has been taken away, and healthcare professionals may pay less attention and help. You may believe that nobody except someone who has also dealt with cancer can understand how you feel. The best way to overcome this feeling is by connecting more with other cancer survivors out there through an organization, through social media platform groups, have meetups with them, join group chats, join group gatherings, weekly gatherings. Keep yourself busy with them and keeping yourself into the particular group that you think understands you well. Emotional factors when it's depression or anxiety, I would highly recommend you to see a mental health professional if you are experiencing significant emotional distress such as depression or even high levels of anxiety. Having a professional there who knows exactly what you're going through can really help you out with your troubles and see life in a different new way. A guided imagery exercise could also help you very much over here, link in the description below. And other soothing breathing methods like the balloon breathing or the 478 breathing methods may also be helpful in dealing with such issues. Emotional factors of memory loss and concentration issues. According to studies, after taking chemotherapy, 1 of 4 cancer patients has memory or attention problems. If you're having trouble remembering things or staying focused, you may want to see a doctor. You may also cope with this situation or these issues with number of ways, such as keeping a notebook with your side, or or your phone, making yourself a little reminder, repeating phrases out loud, or even breaking things down into manageable chunks and put it into your memory. For physical factors, alteration to the body might be either temporary or permanent. After undergoing cancer treatment, your appearance may be the most profound concern. People who have had colostomy, rectostomy due to surgery may be uncomfortable socializing with others. They may worry about being judged or rejected by others, making themselves feel bad about themselves. It's possible that they are also worried about having an accident and looking foolish in front of others, while others react to the public being able to see side effects of the treatments, such as scarring on the face, on the neck, changes in the skin tone, a disappearing of breasts, limbs, changes in body composition, or a loss of hair, just like me. That explains why I wear a hat, why I'm talking this way. Even if the treatment doesn't show, the changes of your body may be upsetting. It is normal to have strong emotional feelings like rage and sadness. You have lost your old body and your sense of self. If you notice a change in your skin tone as a result of radiotherapy and it's been more than 6 months after the treatment, see your doctor about it and ask if it will return to normal. Find new ways to make yourself look better. Changing your appearance with maybe a new hairstyle, a hair color, wearing hat like me, cosmetic or breast shape prosthesis. Is that called prosthesis? Yes, I think so. So you are more than just your cancer. Always remember that. You need to remind yourself you have to value yourself regardless of your appearance or external factors. Think about how having cancer has changed you as a person. More robust, more intelligent, more connected to reality. For social factors, isolations, probably one of the most significant affected areas after cancer treatment. You may sense less support from your loved ones and medical professionals during the after cancer treatments. It is typical to feel neglected by loved ones when treatment has ended. In this process of finding your way, you may have lost contact with some of your friends or grow away from others. It might be challenging to express your grief and loss to others who don't understand what you're going through and insist that you should be thankful that the treatment is finished. Some cancer survivors often struggle to locate friends who can empathize with their experience and help them feel normal. Keep in mind that many cancer survivors experience emotions of loneliness through isolation. So here's what you can do. Communicate honestly and truthfully. The people who cares about you and you the most may not be able to help you if they don't know you're keeping your emotions suppressed. Participate in support groups. Support groups might help you connect with others who have gone through a similar experience. Do things that brings you joy. Doing something that you enjoy like hiking, taking an art class, makes you feel better and helps you meet new people and new friends. Get help. Seek help, professional assistance from a mental health practitioner or even a social worker if you cannot deal with your emotions of isolation, despair on your own. Social factors in family relationship. When a loved one is diagnosed with cancer, it often puts much pressure on the family system. Family members are often the first to help when another family member was diagnosed with cancer. Some loved ones might not understand that just because cancer treatment has ended, it does not mean that the cancer is no longer a threat. Make sure that your loved one knows how you're feeling and how much they meant to you by letting them know they understand the transition you're experiencing, your emotions, your physical and your psychological being. Social factors in the work relationship. Cancer survivors generally desire to go back to work, but many of them worry that their new normal will not be suitable with their routines and connections of their employment. As individuals who have survived cancer, we are responsible for recognizing the stigma that exists, not just from others, but also from ourselves. You may find at times finding it frustrating that tasks which is the usual one was not given to you in the workplace due to your health condition. Your workers may have been afraid of giving you more stress about your situation, worrying your health, or perceiving that you may be an incompetent, staff member. Regardless of the reason, you may sometimes find it very frustrating. And it's our responsibility to let our co-workers know about our health conditions and explain to them our limitations and the activities we can continue doing, just as what we did before. You don't need to force yourself to put on a strong face to let others know that you're capable. All you need to do is inform them what you're capable of and what you're unable to do. And in this way, your co-workers will admire you more and be more willing to stick close to you and work together hand in hand. Thank you very, 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 very much for keeping in tune and watching until at this point. Always remember, there is a can in cancer because we can fight it together. Once again, my name is Joseph. Let's embrace life. See you in the next video.